Improving patient care means changing how we work so that we treat more patients sooner, working more closely with GP practices and using new technology so that patients can get hospital services closer to home.
COVID has resulted in us having a problem with getting patients through surgery. The number of patients we can do in a day has got smaller, and that just means we're getting longer waiting lists, and it's terrible for us and it's terrible especially for the patients.
So my patient's having to wait longer for elective surgery due to COVID. We're looking at different ways of working in order to tackle this problem. So we're looking at increasing our 23-hour pathways through the main day surgery unit at Addenbrooke's, looking at different pathways that would have required an inpatient bed and a 2 or 3 day stay pre-COVID. We're looking at Ely and whether we can put more surgery through Ely, and we're looking at weekend working and trying to do more surgeries on the weekends. Some of the changes are small, but some are much bigger, like the dedicated theatre that's being built for hip and knee surgery.
So with all these new ideas, these new procedures and the new ways of working, we're getting more people through, we're getting more people off the waiting list and home to ready to carry on with their lives.
Dr. Wright, who's a GP at Granta, myself and others have come together to create a virtual neurology meeting. The advantage of this meeting is that it allows us to discuss cases from around the region, and we don't all have to be in the same place to do so.
Introducing Dr. Gordon Wardner into primary care has allowed us to provide a much more seamless service with the patients. We get them seen by the right person in the right place at the right time. They get investigations done much faster, often with discussions with people they feel comfortable with, in a setting they feel more comfortable with. This improves the engagement between both primary and secondary care as well.
Cytosponge was developed by a team in Cambridge and is finally being introduced into clinical practice, which we're very proud of. The Cytosponge is really simply a pill on a string which patients can swallow with a glass of water. It goes down into the stomach. The gelatin capsule dissolves, releases the sponge, and then we gently pull that back, collecting cells all along the esophagus. These cells can then be looked at to see whether they need further care or further investigations. So we're working with primary care, CCG, clinical research nurses, and Heartburn and Cancer UK in order to bring this to patients in the community so that they don't have to go into hospital to access this test.
We're also setting up virtual wards in the community so that patients get expert care in their own homes after leaving hospital.
One of the benefits of integrating care is that it reduces unnecessary visits to hospital and thereby saves patients time. The other major plus is that by working together as a team, we really develop and strengthen this relationship between primary and secondary care.